Today we have the pleasure of speaking to Dr. Marty Finkelstein of Wholistic Chiropractic and Pain Center. Thank you for joining us today, Dr. Finkelstein.
It is a pleasure to be here. Thank you.
Dr. Finkelstein, let's begin by talking about how you became a holistic chiropractor.
Absolutely. Well, many years ago, when I was 23 years old, I was in pre-med at the time, studying to become a traditional medical doctor. And at that time, I began having some very severe digestive problems. And it actually brought me to seeing many different medical doctors, going through many different tests. And finally, I was diagnosed with something called ulcerative colitis. Ulcerative colitis is a disease of the large intestine. Some of my symptoms was bleeding in my stool, pain, spending too many hours in the bathroom at the age of 23 years old. And when I saw these medical doctors, after finally being diagnosed with this problem, what they shared with me was that there was nothing that could be done to correct or cure this problem. And then they shared with me that what could be done was being on steroids the rest of my life, and eventually I might need to have exploratory surgery, and then ultimately it could lead to colon cancer. Needless to say, this is not good news at the age of 23. To make matters worse, my mom had died of cancer at the age of 52. Her brother died of colon cancer at the age of 56. So I was literally on a track to go down that same path, not knowing there was anything different. Thankfully, a few days later, a very good friend of mine shared with me about a chiropractor he was seeing. And he heard about what I'd been going through. And he said to me, "Why don't you come with me to this doctor?" Well, I was 23. I'd never before been to a chiropractor. I wasn't familiar with chiropractic. But I call this the first miracle. The miracle was I listened to what my friends said, and I said, "When can I go?" And when I did finally show up at the chiropractor's office, lo and behold, he began sharing with me what could be done to actually correct this problem. Now you have to understand, I was 23 years old at the time, and I had just seen 4 medical specialists who specialize in the digestive tract. And they absolutely said nothing could be done. And here was this chiropractor, almost nonchalantly, sharing with me that things could be done, but here was the magic thing he asked me. He said, "Would you be willing to change?" Now that is a key ingredient to get healthier. The good news was I was willing to change, and within 9 months, after getting chiropractic care and changing other things in my overall wellness strategies, I no longer had ulcerative colitis, never did take steroids, and that was 35 years ago.
And so that was the beginning.
That was the beginning, and actually what happened, you know, that first visit, I actually was laying on the table, and I remember this like it was yesterday, truly. And he was explaining to me about holistic healthcare. And at one point, it made such perfect sense. He was explaining about the spiritual laws of healing and how it connected to the physical body. I never knew there was a doctor who connected the spiritual law with the physical laws and understood about the physical body. And I was laying on the table, and all of a sudden, I had an epiphany. Again, I was in pre-med at the time. I had an epiphany that this was the kind of doctor I needed to be. Not a doctor who said to someone nothing could be done, but a doctor who spoke to people about possibilities, what could be done, that began to educate people about the strategies that are necessary to actually heal.
So you're saying at that time you were in pre-med?
Yes.
So how did that change your direction?
Well, it was very, the good news was I was taking already these pre-med courses. I went to the library. I was motivated. I went to the library, I found out where are these chiropractic schools. Mm-hmm. And I sent out applications to all these different chiropractic schools. I was already taking the courses that would get me into chiropractic schools, so nothing really had to change there. Mm-hmm. And lo and behold, there was one particular school in Atlanta, Georgia, called Life Chiropractic College, And that one just kind of, for some reason, sang to my heart. It's like when I read about that particular school, it just kind of resonated with my spirit. And I was originally from New York, but I went to undergraduate college in Oklahoma, and literally got in my car, drove to Atlanta, and started chiropractic school in 1977.
Okay, so in 1977.
Yeah.
Is that when you were led to, after your studies, open your office? You have an office in Decatur?
Yeah, I actually opened the office in Decatur in 1982, and have actually been in that office since 1982. It's amazing even speaking about these things when I think of how many years have gone by, because the truth is I'm just as passionate, and matter of fact even more, because here's the crazy part, Rashonda. When I was told at 23 years old nothing could be done for my problem, when I have patients, and that was 35 years ago, when I have patients come into my office today in 2010 and tell me their doctors told them nothing can be done, the one thing I thought would change from when I was 23, 35 years later in the whole health industry would be doctors no longer told people nothing could be done. To me, that is malpractice. Because the moment we tell someone nothing could be done, the sad part is they may not be someone in their life like they were someone in my life to say, listen, why don't you try this? And there's nothing worse than crippling the spirit and the mind. And if people think that nothing can be done, guess what people do? Nothing but taking the drugs. And if I had just got on those steroids and did nothing else, I wouldn't be having this conversation with you today. Either I would be a very sick man, or I would no longer be here. And I would just think that that was normal, because that's what I was trained to do by, sadly, the traditional medical system.
So let's go deeper into the holistic approach. What is the relationship between holistic wellness and healing and Alzheimer's disease?
Great question. Number one, holistic, the very simple term holistic relates to relating to the body as a whole. When we traditionally have gone to doctors, we've gone to doctors who've looked at different parts. In other words, if you have a stomach ache, you go see a stomach doctor. If you have high blood pressure, you see a heart doctor. A pediatrician for a child. In other words, there's all these different parts of our body, and there's specialists who treat all these different parts. A holistic doctor doesn't really treat conditions that have people. He treats people who have conditions. So it's relating to the body as a whole. There are three systems, no matter what condition someone has, whether it's heart disease, arthritis, whether it's diabetes, Alzheimer's disease, regardless of disease or condition, the three systems that run the whole show, one is the nervous system, one is the circulatory system, one is the immune system. Regardless of condition, those systems are not going to be working in balance, or they're going to be being interfered with. So as a holistic doctor, when we get someone's nervous system functioning in a healthier way, that person's going to get healthier. If we get someone's circulation flowing through their body and getting to all the parts of the body, bringing nutrients, bringing oxygen that's necessary for healing, that person's going to get healthier. Those things are going to empower the immune system, which is our defense system. So when our immune system is stronger, we're not getting the things that other people are getting. When our nervous system is stronger, we're not as stressed and our body is not run down. When our circulatory system is functioning better, again, we're getting all the things to our body. Something very, very important, and it relates to Alzheimer's as well as anything else, it's understanding symptoms. You know, sadly, in our culture, what we've been raised to do with symptoms is to mask them, to numb them, to get used to them, to rationalize them, you know, to do everything but to listen to what those symptoms mean. And so all of us, you know, if I know you have children, I have children, a lot of people have children listening to our show. When we bring our child to a pediatrician who has like allergies, and we don't address what's causing that problem, and we just give drugs, the problem gets actually bigger and bigger. If a child has asthma and we just get drugs, if we have colic and just get drugs, by the time a child is 10, they're now on more drugs than I've been on for the last 30 years of my life.
And they build an immunity to those drugs, and
Well,
you have to change.
They build immunity, but also what happens, Rashonda, is their immune system gets weaker and weaker. So the more drugs we take, the immune system actually gets weaker, so now we become more susceptible for even more and more problems. The sad part in our culture is, and I wish it wasn't so, you know, I wish we could say to someone, wow, you've been taking all these drugs, so you must be healthier now than you were 5 years ago. But the answer is always no, I now need more drugs. The problems are bigger. Now we get this when we go to a dentist, because dentists teach us how to take care of our teeth, right? We wouldn't go to the dentist with pain, and the dentist just give us a pain pill and say, come back when you're hurting again. He teaches us how to take care of our teeth. He may say, take a pain pill, but let's find out what is causing the problem. So a holistic doctor begins to ask that very simple question. Let's find out what's actually causing the problem so we can reduce the medicine if you're on it or never even need it to begin with.